Live in Western Oregon, this is NBC 16 News at 5.
We have identified a situation which we need to alert the public about and let you know in an effort to be as transparent as possible.
Good evening and thank you for joining us for NBC 16 at 5. I'm Jacqueline Mazer. Lane County health officials announced a 4J employee was exposed to a known coronavirus case. He reported to work last Tuesday and Wednesday before he knew he was exposed. The investigation by Lane County Public Health shows a small number of 4J bus routes could be a potential exposure point. Officials estimate 240 elementary and middle-aged children may have a minimal contact with the employee. Health officials say these children are not at high risk and the employee has been tested. Results are pending.
If he tested positive, given the public health definition of what an exposure is, so that is with 6 feet for an hour or more, he still would not be exposing the kids given the nature of the job.
Davis says 4J is making direct contact with parents whose students may have been in contact with the employee. He also says more tests are coming to Lane County after the governor announced a state contract yesterday to ramp up testing. However, testing is still limited across the country. The number of confirmed coronavirus cases in Oregon has now reached 88, including 3 deaths. Breaking down the numbers now, you'll notice there are 18 cases in Lynn County, 6 cases in Deschutes, 2 in Benton, 2 in Lane County, and 1 in Douglas County. There are still no cases reported in Coos County so far. Washington State has the most cases at 25. Now, as a reminder, Lane County Public Health does have a non-emergency call center available to answer any questions. That number is 541-682-1380. You can also send any questions via email to corona-info@lanecountyor.gov. The call center is open daily from 8 a.m. to 8 p.m. Oregon Governor Kate Brown and Portland Mayor Ted Wheeler are working on shelter-in-place plans if needed, following in the footsteps of government officials across the nation. While some in Multnomah are gearing up for the possibility, others think it's better not to.
I would, yeah, and I think all the local companies of all different sizes of the organizations are taking it seriously too. A lot of folks are obviously working from home. Teams are doing, FaceTime and different sort of ways to connect with each other.
Shepard says generally younger generations think mandatory sheltering in place is a good idea. Well, as Americans practice social distancing, there are some people who are trying to get back to their families. We spoke with Eugene residents who are currently stuck in foreign countries. Curtis Delawi tells us he had a flight scheduled for yesterday, but that flight from Ecuador was canceled the night before his departure. Delawi says there are at least 40 additional Americans stuck in the same hotel with him.
The embassy can't really help us out that much. The only thing that the only information they can give us is that we should keep contacting our airlines, which has been a brick wall. We should try to contact the State Department, which has flat out refused to evacuate anybody from Ecuador.
Curtis says other than waiting it out, the other option is to charter a flight back to Eugene. However, costs for a charter flight run roughly $5,000 per person. And coming up on NBC 16 News at 5:30, we hear from a Eugene woman who has been stuck in Honduras for several days now. Well, there are more than 10,000 coronavirus cases in the United States and more than 160 deaths. The Food and Drug Administration is now fast-tracking the development and testing of drugs to treat the virus. Chief Political Correspondent Scott Thuman has the latest from Washington.
In another sign of dire times, ships from Carnival Cruise Lines may soon be used as floating hospitals. That's just one of the announcements from the White House task force today, as the president claims progress on medical solutions.
I've directed the FDA to eliminate outdated rules and bureaucracy so this work can proceed rapidly, quickly, and fast.
Scientists and doctors believe they are close to possible breakthroughs, like using drugs already approved for malaria or arthritis that may be effective against coronavirus.
We are looking at everything that's coming across our desks. We have over 17,000 people at FDA who are doing this every day.
Even then, a vaccine trial could take 12 months. The long-term prospects coupled with another reality, unemployment claims rose by a third last week, with furloughs and layoffs looming. Congress now working on phase 3 of $1 trillion worth of help with tax breaks, direct checks to Americans, and a rapid injection of cash to help small businesses survive.
It's not an ordinary policy, but this is no ordinary time. The American people need help, and they need it fast.
Until then, food lines like this drive-up site in Delaware are becoming more common, just as mobile testing tents such as this one in Florida are too. Meanwhile, it's unclear how voting on the House side for new relief bills would take place. Since they are now home, some have tested positive and others are in quarantine, and right now, remote voting is not allowed. On Capitol Hill, I'm Scott Thuman.
The Jordan Cove LNG project has the green light from the U.S. Federal Energy Regulatory Commission. The board voted to approve the project, making it the first export terminal approved on the West Coast. In a release from Pembina, the company behind the project, Senior Vice President Harry Anderson says, quote, "The approval emphasizes that Jordan Cove is environmentally responsible and is a project that should be permitted given the prudent regulatory and legal process undertaken. The project will be officially in the clear once the necessary state permits are in place." Meanwhile, Governor Kate Brown has released a comment on her decision, given a national and state emergency in which the federal government and its agencies are unable to fulfill their basic responsibility to keep citizens safe. It is stunning that the FERC moved forward, on this decision today, approving the Jordan Cove project and Pacific Connector gas pipeline. Well, moving on to a look at weather, NBC 16's meteorologist Josh Kozart joins us now. Josh, happy first day of spring to you.
Happy first day of spring to you too, and it really felt like that. But this first day of spring is a little bit different than those of years past. It's actually starting just a few hours earlier than what it typically does, and it hasn't happened that way since about 1896, which was 124 years ago. And we continue to see these springs get slightly sooner, and it really just falls into the realm where we saw those conditions thanks to leap year. Temperatures, though, warming up into the mid-60s for our daytime highs, so it was very nice out there with the plentiful sunshine and temperatures falling back into the mid-60s, still on the mild side with those clear blue skies. But radar and satellite shows calm, quiet, and clear conditions overhead, and our allergies slightly better than where we were this time yesterday, as high levels are still pending across much of western Oregon. But if you're maybe taking a hike over the next several days, temperatures are going to be into the 60s, but I got rain in my full forecast in just a few minutes.
All right, thank you, Josh. A Veneta-based sanitation company is making sure people keep their hands clean during the coronavirus pandemic. Managers at Above All Sanitation say they can't keep up with the demand for portable hand washing stations. They're set up outside the Eugene Public Library, at police and fire stations, and other parts of the community. Operations manager Travis Gates says the company is maintaining 60 of these stations in Eugene, including 7 sites at the University of Oregon.
And we are trying to provide that with, to as many people as possible, but not overstretching our boundaries where we're running into the scenario of not providing a quality service.
9 additional hand washing stations are set up in the Springfield area in cooperation with Willow Lane Parks. Gates expects 15 more portable stations to be shipped by April 1st. Well, a small business owner in Portland is now adjusting her business to help make medical supplies. The Portland Garment Factory is making 500 medical masks and gowns in hopes of helping stop the shortage of our country's medical professionals. The medical professionals are facing right now, those shortages. The owner says it's not only beneficial to hospitals and care workers, it's beneficial for her as well.
When we realized there was a shortage of medical supplies, it was a complete no-brainer. We can put off other things we're working on and save potentially our company from having to, I could have to lay all my workers off.
Howard says she has already heard from hospitals and clinics from all over the country. She says she's doing everything she can to keep the cost down for hospitals. Well, as a reminder, for the latest information about the coronavirus, make sure to visit our website, NBC16.com, our Facebook page at KMTR News, and download our app, KMTR News, on your mobile device.